Dieting seems to come up every year in January. Everyone starts a new diet. Some tend to be trendy every year. What are you hearing about right now this month?
Well, big this month out from U.S. News and World Report is their annual rankings of best diets every year in January. And this year, January 3rd, they looked at 40 diets and ranked them in 9 different categories. And this year, DASH came out on top, number 1. It's been number 1 for the last 8 years. Mediterranean came in tied with number 1. And then number 3 was new to the list, flexitarian.
Let's talk about some of the, so DASH and Mediterranean diets, and maybe flexitarian too. A lot of these are touted as heart-healthy diets. Is that right?
That's right. So the best overall diet and the best overall diet for health and the best diet with any amount of evidence behind it is the DASH diet. It's been around for a long time. It's promoted by the National Institutes of Health, and large research studies have been done showing it reduces heart disease, it reduces blood pressure, probably reduces some level of cancer, and it really has good data behind it. It's easy for people to do.
So let's talk about the diet that everyone I know, including myself, is on right now, the Whole30, doing 30 days of eliminating certain foods entirely and focusing on maybe some that are healthier. That diet came in very low on the ranking, is that right?
That's correct. So the rankings really looked at ease of use and data behind these diets. And so Whole30 is a relatively new diet with not a lot of data behind it. It's hard to do. It's not sustainable for a long period of time. But I think it's a great thing to do at the beginning of the year. It's 30 days of examining what food does to you and trying to remove inflammatory foods and all the things that we think are probably bad for us.
What do you advise your patients? Do you look at their individual situations and not necessarily tell them that because you're doing the Whole30, they should? What do you look at?
Yeah. So health is a long-term game. And at the beginning of the year, it's always a great thing to try to do something new and different and examine your relationship with food. We live in a very fast-paced world where it's easy to do the wrong thing. And so I think just stopping and looking at your diet and what you're doing and trying to make healthier choices. I really push people to stop and consider even fasting or a ketogenic diet, something new and exciting with some flash. DASH diet is excellent and it has great data behind it, but it's not very exciting.
I have a really good relationship with food.
Yeah.
Way too good.
Oh yeah, it loves you. Huh?
You're doing it right now.
The Whole30, yeah.
And
he's doing it, that doctor. It is pretty hard. I agree,
tough.
it's not sustainable over the long term, but it teaches you some things.
she's only passed out like 4 times on air, but it's fine.
Right.
She's doing good.